This is a patient that I've taken care of for a while now, and this patient has had a few lumbar fusions, L3 through the sacrum, still has a fairly reasonable lordosis. We've talked about that before, patients having lumbar fusions and end up having what we call a flatback. Then they had another injury, and they have a lot of pain out of L1-2 and a bit of L2-3, had an endoscopic discectomy at 2-3, and we're doing okay, now has significant back pain. So we're going to come over, we're going to cut the rod instead of taking the whole rod out. We need to put a new screw in here. So we're going to cut the rod right here and then put new screws here, here, and here, and then also do our inner body fusion. This is the MRI of that patient. So you can see it's a bit stenotic here, pushing into the dural tube a bit. Big Modic sign here. Okay, we're done. This is L1. Screw looks good, had great resistances on testing. Come down. Big fill, big fill of this vertex. This is like an anterior implant. And so this is very, very cool to come in from this posterolateral approach. Come through, look really good here. You know, we've fused this joint. Screw looks good here. We go to our next one. Massive fill, just massive. Our last screw looks good. So then if we come over here, you know, you can just see we got nice, really nice fill and lordosis. We've maintained our lordosis, which is super important. You can see that. Good contact with the vertebra. To the right, everything looks good. And then this is the front, or what we call the coronal view or front back view. And you've got really great fill here, and here. This is spectacular. So this should give this patient a lot of relief. And before we did the 3D spin, we did a 2D to make sure we got lordosis built into this. So the whole lordosis looks very, very good. And that's going to be critical for this patient because the patient's had multiple spinal fusions. So this should lessen the probability that this patient is going to end up having a flat back situation.